Hi, my name is Suzanne, and for our cultural challenge presentation, I have chosen a female patient that I've recently taken care of. She was very young, 31 years old. She's from the Middle East, and her religion was Muslim. So she was scheduled for brain surgery. She had a very rare brain tumor. So she refused male nurses to take care of her, and she had to cover her hair before anyone could enter the room. So the big question that we have was, how can we perform nursing care to this patient when we have to assess her incision, which is on her head? So to reflect and answer the questions. So when has culture been a factor in care of a patient or colleague? So as I've mentioned, I've chosen a culture that's affected my care and taking care of my patient. Just I've mentioned, taking care of this female, very young Muslim patient who had brain surgery, who refused for her hair to be exposed. So we were having a difficulty in taking care of her because we need to assess her one. Was I aware of the influence of culture in the care of the patient at that time? So at the beginning of when we got the patient from PACU, it was the middle of the shift, so everyone had patients already assigned, so we had to shuffle around because the nurse who had an empty spot or had less patients was a male nurse, so we had to shuffle around to make sure to accommodate the patient's request. Did I become aware of the influence of culture after I cared for the patient following a reflective moment? Definitely. It was a big eye-opener for me because, we do ask for religion when we admit patients, but sometimes we do not take it into big considerations because I'm just so used to taking care of patients the way I would take care of anybody else. I take care of patients with brain and spine surgery, so it's always the same. We have to assess their wounds. We have to check them on a daily basis. So that was a big cultural um, thing for me to experience. Was there a specific event that brought about awareness? So my first question was like, how am I supposed to take care of this patient if she's refusing for us to check her incision? So that was actually the event itself. Was there a conversation about the patient's life and priorities incorporated into this experience? So it was very hard because she was very young, and mostly for Muslim people, I have realized that they tend to be very, very, they don't talk much about it, so we had to take that into consideration. But much more of the conversation was with my coworkers, trying to understand their culture. So we had to dig deep. I do know that Muslims cover their hair, but actually I did not know exactly what the reason was for, so I had to dig deep and had to figure out that it's because of their religion, their obedience to their Bible, which is the Quran, and to Allah. How was your culture or spirituality related to the experience? So definitely very different. I am Filipino Chinese by culture, and I'm also a Christian. So I believe in God, and I do also believe that for Muslim they do believe in Allah, which is their God. But we do not believe in covering or having any type of preference for a male or female taking care of us. What was learned from the experience and what was confirmed from the experience? Definitely what I've learned is to take much consideration about religion. Sometimes I just ask and really do not understand what they believe in. And confirm from the experience that it doesn't matter if I'm taking care of this patient, but their culture really does affect how we take care of them. I think that's one thing. Whatever they believe in, I have to respect, and I know for a fact that it will affect the way I take care of them. So that's my presentation for our cultural challenge, and thank you very much.